Well, 3 years on and millions are still dealing with COVID, not just physically, but emotionally too. In fact, as we are about to see, the numbers of depressive or anxiety disorders are staggering.
Dr. Jessica Britt Thomas is Director of Integrated Behavioral Health in the Department of Family and Community Medicine at MCG Wellstar, and she stopped by to talk about this topic and what can be done. Dr. Jessica Britt Thomas, thank you for joining us here today to talk about, again, an issue that affects millions and millions of people about here. Let's talk about post-COVID life and the impacts of the mental health conditions because of that.
Yeah. Well, overall, we found that there were alarming rates global and then also kind of U.S. based, right? So globally, we found a 26% increase in reports of anxiety and depression particularly. When we talk more U.S. based, we found that during 1 year past COVID, or the initial kind of onset of COVID, there was a 5% increase in people reporting anxiety symptoms and also depression. And we also identified particularly that the individuals who were having job concerns, the youth, and then women were reporting higher rates of anxiety directly related to the COVID impact, pandemic, and the changes and everything that we were going through at the time.
And just by you saying this, I see so many examples in my mind, like friends and family. Yes, so it really affected a lot of people.
Absolutely.
It did, and it was gradual. It wasn't something that we knew about earlier on, and that's why research and data collection kind of went throughout and even present day.
Right. And Dr. Jessica, what impact did COVID have on social interactions?
Yeah, so we know about social anxiety disorder. It's a mental health condition that's marked by kind of intense anxiety and fears around social settings, particularly with the perception of being negatively perceived by others. And so people tend to just outright avoid social gatherings. So what do we know about what happened in COVID? We all lived it, right? We had quarantines, lockdowns, school work closures, distancing, and then non-essential avoidance of social interaction. So that kind of fueled people who already were struggling with social anxiety, that fueled their symptoms even more. It is important to also note that only people who were already experiencing social anxiety prior to the pandemic reported an increase in social anxiety after or during. And then those that were actually actively being treated, so they were seeing a therapist or taking, whatever medications or interventions, they did not report an increase. So we're talking a specific small group of people that struggled with social anxiety during the pandemic.
So we could actually be looking at a larger number for the people that didn't report this.
That's true. That is true. And there is always the error or the mishap of people not reporting altogether.
Let's talk about transitioning out of quarantine and life post-COVID. Let's talk about the impacts for that on that social anxiety.
Yeah, well, I think a lot of us, including myself, kind of immediately got excited. Hey, we're going to go back to normalcy. And that's just not what happened, right? We found that the resocialization, just that initially kind of coming back together, us sitting this close together, right away.
Is this 6 feet?
This is, I don't know. It caused an acute kind of distress for those who were already struggling with impacts around that. A lot of it was the threat of containing or contracting the virus, spreading it. And just not also understanding how to engage with social peers because there had been such an isolation for some time. CDC did a household survey, and found that college students in particular who jumped right into high frequency engagement, so that's kind of just starting doing extracurricular activities, nightlife, reported a temporary increase in social interactions or social anxiety in interactions. And then those who primarily communicated via email, we call that character communication, and as opposed to video, telephone, or in-person meetings, also reported difficulties with that reintegration once restrictions were eased.
I'm a hugger. So then the day
you weren't during COVID?
I wasn't. And the day I said, I can hug people back again, I was so happy. Yeah. So you've been on Morning Mix or Mix at 3, you know that I'm a hugger.
Yes.
And people would still go,
I was going to say, nowadays you kind of still have to make sure it's okay.
Yeah,
I'm a hugger as well, and I've noticed I can't just do that automatically anymore. I have to make sure that they're okay with that.
Exactly.
And that's also changed. Touching has changed.
A lot, So let's talk now about the positive implications of COVID on mental health.
Yeah. So we talked about the bad, but there were some positive things, particularly around treatments, right? So during the pandemic, some of the guidelines were lifted and flexed. So AU providers, particularly licensed based in Georgia, we were able to provide telehealth services to South Carolina residents across the state lines, which was something you could not do prior. We also had the invention of telehealth, which is not new, but it became kind of like a primary modality of telehealth, telemedicine, and you're probably still experiencing some of that now. That's offered with your providers as an alternative option if you can't come in, and it's very popular. We saw school-based programs. As we mentioned earlier, youth had an increase in some anxiety and depression. There was also kind of suicide as well, which we didn't get into too much today. But school-based programs were developed that were centered around early detection and preventative measures, providing resources and options for our students. And we had the 988 crisis line. I've talked about that a couple times before, and that came directly through COVID, ways to be able to find people to interact or be able to touch them if they are not able to come in physically. So that was developed in 2022. And then more access to substance use treatments in particular.
Yeah.
It's always good to end on a positive note, even for a serious subject like this. But yeah, there is light at the end of the tunnel.
There is, and we're still using a lot of those techniques now. So it's been great.
All right, good, great information to share. Dr. Jessica Britt Thomas, thank you so much.
Thank
Appreciate
you.
it.
Thank you.